Congressman and Dr. Michael Burgess of Texas joins us now a day after the House voted for the 33rd time to repeal all or part of the Affordable Care Act. And Congressman, do you expect a different result this time? You said yourself that the Senate's probably not going to pick this up.
Yeah, but still it's important to get out there with the information. I mean, people watched the Supreme Court decision 2 weeks ago. They may now have a particular mindset, but realistically, what we all affectionately know as the Affordable Care Act is so flawed from start to finish. Remember, this thing was basically the rough draft of the Senate that accidentally got signed into law in 2010. It's full of drafting errors. As we learned from the Supreme Court, it's full of new taxes. And clearly people need to be thinking about this. Supreme Court ruled. You're going to hear from the Court of Public Opinion in November. Important for us to keep talking about this.
I want to read you a headline from Politico, this story out just yesterday evening. Even as they cheer, the headline is Republicans fall short on health care promises. Even as they cheer their Obamacare repeal vote, there's a reality check. House Republicans have done next to nothing they promised they would do when it comes to health care. They've fallen short on what they promised the American people they would do when it comes to actual policy. Flashback to the campaign promises of 2010. GOP leadership told voters they would enact medical liability reform, allow Americans to buy health insurance across state lines, expand health care savings accounts, ensure access for patients with pre-existing conditions, and permanently prohibit taxpayer funding on abortion. 18 months after taking the majority, they passed only 2 of those, an abortion bill and liability legislation. Your response?
Well, it's been tough sledding because although the Republicans and conservatives hold the House of Representatives, the Senate is an obstacle, and clearly the other end of Pennsylvania Avenue continues to be pose a difficulty as well. I'll tell you the truth, I was ready to go with a bill covering people with pre-existing conditions had the Supreme Court knocked out the Affordable Care Act. I'll still be introducing that. I'm having to change some things now that the Supreme Court didn't do exactly as I thought they would do. So I'm having to change some things, but I'll be introducing that before the end of this month, and I hope that can form the basis for some discussion as we get into the fall campaigns. I mean, you know, look, we were told when the President and Speaker Pelosi were selling us on the concept of the Affordable Care Act that there were 8 to 12 million people who suffered pre-existing conditions who could not get health care. The actual number of people now covered under the new federal pre-existing condition insurance program is 62,000. That's not quite the same number. What it demonstrates is that in the large group market, this was not a problem. There are open enrollment periods. This drops off as it's in the large group market. It is a problem in the individual market. It's a problem in the small group market. We can fix that. I mean, there is a finite number of individuals who need help. States have risk pools. States have reinsurance programs. And certainly the bill that I will be introducing is the concept that we build on those programs and encourage the states and help the states with that. Why did we need to spend the overhead dollars on a new federal agency? If we had just simply spent the overhead dollars on helping states with their existing programs, we actually would have helped more people.
You talk about the bill you're going to be introducing. The big criticism that Democrats have had about this repeal vote is that there's nothing on the table right now to replace it with. And I want to show you a comment yesterday on the House floor from Al Green, a Democrat of Texas, talking about this issue.
A good friend, by the way.
I had to read this bill. My constituents insisted that I read this bill before voting on it. And my constituents want me to read this bill. This is the replacement bill, and they want me to be sure that I understand the replacement bill before I vote to repeal. So what I'd like to do now, for all within the sound of my voice and who are viewing this, I want to read the replacement bill. I shall read the replacement bill. Let me just read half of it first. I shall now read 1/2 of the replacement bill. Now I shall read the other half of the replacement bill.
Congressman, did Republicans make a mistake by not having a replacement bill in place and ready to go before these rounds of votes on repealing?
Well, look, and this is the difficulty that I ran into with the pre-existing bill. I mean, existing law today is this. So anything that I introduce, folks, the good lawyers at the Legislative Counsel's Office say, forget it, you've already covered that under under the president's bill or the president's law. The problem is it doesn't cover the people it was intending to cover, and it costs way too much money. So I'd like to improve it. The problem is I can't improve it because this thing is standing in the way. Now, I will help Representative Green because he is a good friend. He's a Texan, and we share a lot of the same ideas and values. So I'll certainly be providing him with a copy of Republican plans. There is no shortage of Republican plans. We are bursting at the seams with Republican plans. For people who say the Republicans did not do anything for the years that they were in power, where did the state children's health insurance program come from? Was not that a Republican Congress that passed that? My first year in Congress, when the Medicare Modernization Act that allowed the Part D program to come into existence and an expansion of health savings accounts, was that not a Republican Congress and a Republican president who signed that bill? There has been no shortage of Republican ideas on health care. The problem is that people don't like to report things.
Well, if you want to call in and talk to Congressman Burgess of Texas, a Republican, give us a call on the Democratic line, 202-737-0001, the Republican line, 202-737-0002, and the Independent line, 202-628-0205. Up first from Illinois, from Naperville, Illinois, Michael on the Independent line. Michael, you're on with Congressman Burgess.
Good morning.
Good morning, Michael.
Back in November of 2011, our Chicago Tribune, which is the major paper around here, had an expose on who makes up the 1%, these top wage earners. And there's about 3 million people approximately in that category. And about 650,000 of them, that's 20%, are doctors. And they also said that if you take the other doctors that are, I guess, the specialists, they kind of fall into the second percent. So the top 2% of wage owners or earners in the whole country are the doctor class. And I hear you guys talk about all this nonsense, every excuse under the sun to avoid dealing with the fact that the medical community makes money way out of proportion to what the rest of us are earning. My wages have been going down over my working career. I actually peaked in 1987. That's when I had my best year in terms of adjusted real dollars and buying power.
Well, Congressman, you're a doctor. Give you a chance to respond.
Well, in fact, my income line probably peaked earlier than his and began its transition downward, and perhaps even more sharply than his. But look, why do we do this? And this is one of the things the president did when he was arguing for the Affordable Care Act. Why vilify the very class of people that you're going to need to help you if you're going to transform health care in this country? Let me just tell you something right straight up. Access to a health care plan does not mean access to health care. One of the things the Affordable Care Act does is double the volume of people who are on Medicaid, and yet the reimbursement rates are so poor that you don't have physicians seeing patients in Medicaid. In my own state of Texas, 30% of physicians will see a new Medicaid patient. I mean, that's a real problem. So what is going to happen when you expand Medicaid? Those patients are going to show up in the emergency room the same as they do now. What problem have you fixed with that? You need doctors to be your allies, to be your partners in this. And one of the things I have never understood is why the administration chose to vilify physicians as part of their run-up to the passage of this law.
Do you agree with Governor Rick Perry's decision to opt out of some of these health care expansions we're talking about and the pools that are being created?
I think Governor Perry is wise to be very circumspect and very cautious. The landscape, the road ahead in healthcare, and especially with a federal partner in healthcare, is very, very uneven. It's a very rocky road ahead, and I think the governor is wise to be circumspect in this.
We have a chart here with the number of uninsured in the U.S. In 2009 and 10, Texas topping the list. There was a editorial in the USA Today this morning criticizing Rick Perry for doing this, saying he could bring down that number if he accepted some of these provisions of the health care law.
But one of the success stories of Texas is our robust safety net program and safety net hospitals that actually care for individuals who otherwise would not have care. And yet, what is going to happen under the President's plan and under the Affordable Care Act, and what Secretary Sebelius is doing, is those dollars are going to be robbed from those safety net hospitals. and used for other purposes, and as a consequence, the uninsured in Texas will actually have less access to care, or could have less access to care, ironically, under the Affordable Care Act. The other big problem we have in Texas, and you know this, we have a 1,200-mile border with our southern neighbor. We do have a problem with people who are in the state without the benefit of a Social Security number. The president, in his speech to a joint session of Congress, September of 2009, said no one except people who are legal citizens or legal immigrants will be recipients of the new Affordable Care Act. But in fact, if you don't do something about the individuals who are in the country without benefit of Social Security number, you've not changed anything. Those safety net hospitals will continue to be inundated with people who are here without the benefit of citizenship.
Pam on the Republican line from Waynesboro, West Virginia. You're on with Congressman Michael Burgess of Texas.
Yes. Republicans keep saying, oh, we have a plan, and yet there are never any details given to that plan or what their proposal would be.
Pam, let me ask you a question. I mean, here we've got the Affordable Care Act, and as people have talked about, it's 2,700 pages of dense instructions to federal agencies about what to do with us in our lives. Wouldn't it have been a better approach? We acknowledge that there were problems in the healthcare system back in 2008, 2009. Wouldn't it have been a better approach to take the 5, 7, 9, 12 things that needed to be fixed and have focused pieces of legislation to deal with those problems, rather than this, which actually tells you how you're going to live your life, may tell you when you've lived enough life. But why did we have to have this type of interference from the federal government? The things that needed to be fixed, some of them could have been done by administrative action in an afternoon. They did not require 2,700 pages of dense federal instructions to the federal agencies. But I would also say that most people who reject the notion of the Affordable Care Act do not want to see a Republican 2,700-page bill to replace the Democrats' 2,700-page product. Fix what is broken. Don't damage the system that is working for other people. And then the one thing that people have asked us over and over again, if you're going to do anything at all, can you help us with cost? Because that's what really frightens people.
Betty from your home state down in Fort Worth waiting to talk to you on the Democratic line. Go ahead, Betty.
Good morning.
Good morning, Betty.
Thank you very much. Listen, I was listening to the representative, and yes, I understand that the Republicans did pass the Schedule D. Again, it was done very late at night with the coercion of the hammer, so to speak. It was not paid for. Then on top of that, we have 2 wars that weren't paid for either. All of that was put on the credit card. But also, I've got a comment about the... you say that there's only 62,000 with pre-existing condition.
In the federal pre-existing condition insurance program, as of the middle of June, that was the enrollment figure that I was given by the federal agency.
Well, then why do most insurance companies count pregnancy as being a pre-existing condition and will not cover second or third babies if there are a problem?
Actually, I don't know that that's entirely the case. I mean, I did spend my life practicing obstetrics and gynecology back in Texas. Again, the pre-existing condition phenomenon is a problem in the individual market and the small group market. People who are covered under employer-sponsored insurance in the large group market, that tends not to be the type of problem that an individual who goes out and buys in the individual market. So why don't we provide the protection for the individual market, for the small group market, that is already provided for the large employer-sponsored market? And that has been the question that actually has plagued me long before I ran for Congress. If there was one thing that I could fix, that's what I would try to do, was to try to make those two markets more similar. Now, the issue of someone who then wants to buy insurance the last trimester of pregnancy, yeah, you can understand where the insurance companies say, wait a minute, this is a concept of shared risk and risk that is spread out over time. We can't concentrate it all in the last few weeks of a gestation and expect to be able to be in business next week when the next mom delivers. So I don't have a real quarrel with the way they've structured that. The bigger problem is, yeah, people need to recognize as they start their families, they are going to need health insurance. Let's help them be able to have access to the type of policies that will actually work for them. Let's encourage the insurance companies to actually create products that people want. When I was in private practice, of course, I provided insurance for my employees.
And what was your practice?
Where was it?
What was it?
An OB-GYN practice in Louisville, Texas. But why, every year, of course, I looked around for the best deal from companies, and people's insurance, my employees' insurance might change if I could find something that was a little bit better. But what a better world it would be if you had a longitudinal relationship with your insurance company, or your insurance company actually could see value in keeping you healthy. Make sure that you had those periodic screenings. Make sure you attended to your health. Every car guy will tell you you can lengthen the life of that your car will work if you do the periodic scheduled maintenance. The same is true for us. And unfortunately, we have a system now where, yeah, you do try to move from year to year to try to squeeze a few dollars off of that particular cost on the balance sheet. But I long for the day that an insurance company would work with me in my business and try to help me provide longitudinal coverage for employees.
Well, you talk about what you might replace it with. Boring File Clerk writes, Romney has pledged to repeal and replace the health care bill. What bill does Romney plan to replace it with?
Oh, you'll have to ask Governor Romney.
I haven't had discussions with him about it?
No. You'll recall I actually supported a different candidate in the primaries.
Not privy to the inner campaign workings.
Correct, but we're working on that.
Let's go to London, Kentucky. Frank's on the Democratic line. You're on with Congressman Burgess this morning.
Good morning. Thanks for C-SPAN there.
Good morning.
And well, I just had a couple comments there. I'm glad he called it Affordable Health Care Act instead of Obamacare. Show a little bit of respect anyway. And another thing is, I was just wondering if any Republicans get sick, and because I'm a disabled coal miner. And my third question is, I would just like to ask the representative if he draws Social Security and Medicare. Thank you. And I'll hang up and take your answer off the air.
Well, I guess he asked if I drew Social Security and Medicare. The answer is no. I'm not of the age of Social Security and Medicare. Obviously, as a member of Congress, I do pay into the Social Security system. I do pay the payroll tax for Medicare, so I am paying into those systems, but no, I currently do not draw from those. He brings up an interesting point about being a disabled coal miner, and I have worked with some of the representatives from Virginia and West Virginia. There are problems as it exists in the Affordable Care Act for some of the programs that right now benefit people just such as him, and trying to work on removing those rough edges. But honestly, the Affordable Care Act didn't deliver as promised. It was full of drafting errors. And look how the thing was written. They went down to the White House with special interest groups. The president said this is going to be transparent and open. We'll all be around a big conference table. If your representative is standing with the insurance companies instead of the people, you're going to know it because it'll all be on C-SPAN, correct? But unfortunately, it wasn't. It was when it came time to write the bill, they called the special interests in. They closed the doors. They wrote the bill, and the next any of us saw of it was on the House floor.
Let's go to Charlene on the Republican line from Dale, Texas. Also, once again, your home state. Charlene, you're on with Congressman Burgess.
Hi, Congressman Burgess.
Good morning, Charlene.
I've got a couple of comments and question. My first comment is that after Romney was at the NAACP meeting yesterday, and he said the comment where he said Obamacare, but then the next statement was about the Chamber of Commerce, that something like 3/4 of the businesses say that they'll quit hiring. Well, that was an online survey, and even the Chamber of Commerce, the U.S. Chamber of Commerce, of course, says that that's not really a scientifically done survey. So I kind of wish that y'all would quit using that. But my question is,
Can I stop you for 1 second? It's my heart to hear you say y'all.
Y'all,
please
okay.
go ahead.
Well, my husband, both of us got sick from eating some food at a restaurant in Florida. We got this disease called cyclospora, and it's a middle intestine disease, and it affected his immune system to where he actually ended up getting another disease from, guess what, a shower head, a risky activity. And so now he's got an infectious disease, and we're self-employed, and our insurance went up in the 2000-2001 period, way before Mr. Obama came into office, and we had to drop it, so now we're insuranceless. And since Rick Perry is not allowing us to buy into a group, and my husband's got a pre-existing condition, I'm kind of leaning toward voting for someone that's gonna, satisfy my problem here.
But you're actually fortunate because Texas does have a risk pool for people with pre-existing conditions. No, it is not free. It does cost the charge for the premium, and it's probably a little bit higher than the premium on the open market because of the fact that it is a risk pool. But Texas actually has done a pretty good job with setting this up, and this was always my complaint about the Affordable Care Act. Why do you have develop a new federal program when there are already in existence state programs that are working well for people? The biggest problem that Texas has with this risk pool is that the amount of dollars that the state is able to put into that is limited. Well, if you took federal dollars and supplanted, not supplanted, but augmented those state dollars, yeah, maybe you ask for the private sector, the insurance companies who want to sell insurance in Texas, to participate in that pool. But that's a much more powerful way to produce that arrangement, and likely to provide much more in the way of help for someone like you and your husband. Fortunately, this large federal program that's been set up but is actually helping only a few people. And what was the cost of the federal program that was set up? $5 billion. We could have provided a lot of help to states with that.
Gates, North Carolina. Crystal is on the independent line for Congressman Burgess. Go ahead, Crystal.
Yes, Congressman Burgess.
Good morning, Crystal.
I'd just like to know, why is it that we are giving away free health care to Iraqis, but not for American citizens?
Well,
thank you. Bye-bye.
As you know, of course, the United States ended its activity in Iraq in December, so if it was happening, it's not happening now. So, again, I don't have direct knowledge that that was actually occurring, but at the same time, if it was happening, it's been concluded.
Frankfort, Kentucky. Thomas is on the Democratic line. Good morning, Thomas.
Good morning, sir. Thank you for taking my call. My question is about Medicare. I'm a senior citizen and I'm retired and drawing Medicare. Currently, $96.50 a month is taken from my Social Security check, and one of the gentlemen callers to C-SPAN yesterday said that his premium was going from $96.50 to $247 a month. Can you tell me anything about this, sir? Thank you.
Well, that's the first I've heard of it. He's referring, I think, to the Part B premium, the $96 a month figure that is withdrawn from the Social Security check. Part B is optional, but most people do take that. If there is an adjustment upward of the Part B premium, that's likely to occur in the month of the 1st of October at the start of the new fiscal year. I really can't comment on that large an increase because that's the first I've heard of it, but I'll certainly look into it.
Congressman, I want to talk about the larger economic picture and your outlook. This news alert this morning from the Associated Press, the number of people seeking unemployment benefits plunged last week to the lowest level in years, a hopeful sign for the job market, but the decline was partly due to temporary factors. The Labor Department says weekly applications dropped 26,000 to a seasonally adjusted 350,000, the lowest level since March 2008. The 4-week average fell to 376,500. When applications consistently fall below 375,000, it generally suggests hiring is strong enough to reduce the unemployment rate. Your thoughts on the trends in the numbers?
The trends have not been good through the July 6 numbers that were released by the Bureau of Labor Statistics last week. But if there's encouraging news, I pray that it's continued. I mean, the one thing that will bring the country out of the recession is putting people back to work. The old saying goes, we don't need new taxes, we need new taxpayers. So I'm happy that that is that has been indicated by that report. I mean, you and I both know that a single data point does not define a trend line, but I pray that that trend line does establish.
Your response to Democrats who say Republicans are cheering for bad number reports?
That's absolutely false. That's absolutely false. I mean, the country is hurting. We all want the country to be better. I mean, that's the one thing that really strikes me, that, it doesn't have to be like this. We can do a lot better.
Bardstown, Kentucky. Ellen is on the Republican line. Good morning, Ellen. You're on with Congressman Burgess.
Yeah, what really upsets me
Good morning, Ellen.
is people, good morning, don't see that if you took any size piece of paper, you fold it in half, again, that's 4, then you go 8, you go to 16, you go to 30 seconds, and you tear off that little 30 seconds, then you look at the big piece, and that's how much difference there is now to you getting an X-ray. There are like 30 in line with you to get an X-ray because they didn't increase all the benefits to get the X-ray.
Ellen, what's your question for the congressman this morning?
That this, the way it was sold to us, to how many people would be in the availability, that would be your ticket. If you took the piece of paper, made it into 32 little squares, now you've got your health care place, but you've got 31 other people there that are going for it.
That they're competing for that same sector of healthcare that you're there to consume, and that is a valid point. There was nothing done to affect the supply of physicians, the availability of healthcare, and that was the point I was making earlier about the by reducing the number of uninsured by just a presidential fiat of expanding Medicaid or a congressional fiat of expanding Medicaid. There's no place for those Medicaid patients to go today. Where are the additional 15 million going to go?
Steve Baltimore writes in on Twitter, would like to ask the congressman how someone who works for minimum wage is supposed to afford insurance without some kind of help.
Well, there always have been options, and the online group ehealthinsurance.com has always offered a high deductible policy in several age groups that is eminently affordable. But the difficulty, of course, is the working a minimum wage job without benefits. If we improve the job market, if we improve the job possibilities and job choices for an employee like that, that ultimately is going to be the solution for their problems. It's not setting up another government program where he's at the whim and the beck and the call of this or future Congress to decide, look at today. They say the Affordable Care Act has gone from a price tag of just under $1 trillion over a 10-year window. If you move that 10-year window to today, the total projected cost by the Senate Finance Committee is $2.6 trillion. At the end of this year, we're going to have a financial cliff that we all roll over. There's likely to be another debt limit discussion without all the good feelings of August of 2011. There are going to be problems. There are going to be financial problems in the future. The road ahead is rocky. You can't necessarily count on that benefit that you've been given by your government today still being there tomorrow, because what's going to happen with these rescissions that are going to, we all hear about defense, but what about Department of Health and Human Services? What plans are they making for the 7 to 8% reduction, across the board reduction in the discretionary spending levels January 1st? I mean, this is not speculation. This is law that was signed by the president in August of 2011. This is going to happen. What would happen if? What would happen to those benefits that a person has been counting on if suddenly everything's reduced 7 to 8% at Department of Health and Human Services? Their benefits would be at risk. This is the problem. People do need to wake up and look over the horizon. There are big troubles coming.
A lot of headlines today about the number of times that the House has voted to repeal part or all of the health care bill, this being the 33rd time yesterday. Ron from Colorado writes in, why not work on a related issue like tort reform? You do not need to repeal the ACA since tort reform was excluded from it. It will not solve the cost of health care problems, but it would be a start.
2 points. Number one, of course, there have been tort reform pieces of legislation that passed the House going back to my first year in Congress, 2003. I never could get the Senate to take that up, even with a Republican majority and a doctor as the Senate majority leader, so that has been a problem. But realistically, tort reform belongs to the states. Texas has done a good job with copying some of the provisions of the Medical Injury Compensation Reform Act of 1975 out of the state of California. We have caps on non-economic damages. It's a little bit different from California. It's an aggregate cap of $750,000, but it's working. Counties that didn't have an ER doctor or an OB doctor 10 years ago now have one because the liability climate has improved so much. It does need to be tackled by the states. Unfortunately, there are states that just simply will not take it up. There may be another way to look at this. Since Medicare is a federal program, is there perhaps a way to provide some liability relief within the Medicare program itself that obviously is already exists in in all 50 states, and you would not have to threaten state sovereignty in order to do that. But medical liability is a huge issue, and you're right. It's one of it's one of the missing links from the Affordable Care Act. Where was the liability relief? Where was the fix for the Medicare physician payment formula that's been flawed for so long that we have to come in and fix it the last minute every December? What about allowing doctors to talk together about what it costs to deliver their care? You can't actually ask your doctors to be participants in this brave new world of health care and hold costs down if we won't let them get together and talk about price. But the minute you do that as a physician, the guys from the Federal Trade Commission are going to come in and ruin your day. It's going to cost you a couple of $100,000 to beat back the charges. You will be able to do that, but it certainly will mess up your life for a long period of time. Why did we not improve that environment when all of this was going on?
Got about 5 minutes left here talking with Congressman Michael Burgess. Practiced medicine for about 30 years in North Texas. And
25.
25 years, OBGYN up there in North Texas, down there in North Texas. We'll go to Elgin, Illinois. Thomas is waiting on the independent line. Good morning, Thomas.
Good morning.
Good morning, Thomas.
Good morning, Congressman. Dr. Congressman. Just two things.
I'll just point out to you that Doctor polls better than Congressman, so go ahead and call me Doctor. It's better.
Okay. One of the things, two things I wanted to say. One is that people who are pregnant can't get individual insurance. I'm an insurance agent. They can't get insurance. Not only expectant mothers can't get insurance, but expectant fathers can't get insurance. The second thing is, you were talking about 62,000 people covered under the pre-existing condition insurance.
The federal program, correct.
Well, yes, but that is something that's fixable by Congress because there is a cap on the amount of money for that program. States would expand that program if Congress put more money into it.
Well, and that's exactly the point, and thank you for making it for me. Why spend more money on setting up a federal program, which is a new program under the Affordable Care Act, but why not help those states that already have their risk pools, their reinsurance programs, or other ways to help deal with that problem? The $5 billion that was spent setting up this new program could have been vastly better used by helping people by helping the states who are already helping their citizens with existing risk pools and reinsurance.
Let's go to Frank from Oklahoma City this morning on the Democratic line. Good morning, Frank. You're on with the Congressman.
Good morning, Frank.
Good morning, and thank you very much for taking my call.
Sure enough.
I just appreciate it. I was wanting to ask the Congressman, I'm a retired federal employee.
Yes, sir.
And when I worked for the post office for about 27 years, they paid about 70% of my premiums. And I was just wondering if that was one of the reasons that the Postal Service was having so much financial problems. And like that Congress lady said before, I think that might be a good place to find some money if they would pay their full share. Thank you for taking my call. You have a blessed day, gentlemen.
Great. Thank you, sir. The question is a valid one. But honestly, if there have been promises made to federal retirees on continuing those health benefits, you can't just stop because people are going to be hurt by that. I dare say the caller would be hurt by that. So yes, there will have to be some things happen in the United States postal system because the money is just not inexhaustible. At the same time, I don't know that that's exactly the fix that most people would be looking to.
Try to get in one more call this morning from Mary from Louisville, Kentucky on the Republican line. Mary, you're on with Congressman Burgess.
Good morning, Congressman.
Good morning. Morning.
I'm a healthcare professional, and there are great areas of concern in this bill to me, one of which I don't think has been discussed very much, probably because a lot of it hasn't been ironed out yet, and that is the Independent Patient Advisory Board. I'd like to know if anybody knows yet when we're going to be able to see who's on it. Are we going to be able to know why they're on it, where they come from? Are they going to be medical people? I've heard they're going to be ethicists and people from academia. I'd like to be able to see that process and read about the folks that are going to be deciding what types of devices.
Congressman, give you a chance to respond.
Well, Section 3403 of the Affordable Care Act reads, the appointed membership shall include individuals with national recognition for their expertise in health finance, economics, actuarial science, health facility management, health plans, integrated delivery system, reimbursement of health facilities. At the very last, allopathic and osteopathic physicians. You know, they don't give a lot of credence to whether or putting actual healthcare people on this. We want people from think tanks. We want certified smart people. We want economists. But we're not really so much interested in someone who's working in the trenches and someone who's actually working on trying to deliver care to people. And that's one of the big fallacies. The other answer to your question, when will you know who those 15 people are? They are appointed by the president. They are likely not to be appointed until after Election Day. You can use your own judgment as to why that would happen. But when we've asked Secretary Sebelius, who's come to our committee, we've asked her specifically, can you give us a list of the people who are being considered for these 15 positions? The answer is no. They don't want to tell you till after November 7th because, after all, it might affect how you voted in November.
Something you're continuing to push her on to get to, or are you just assuming that it's not going to happen?
Well, the board needs to be set up, and here's the other thing: all of these people will have to be confirmed by the Senate, and we all know how difficult that has been with various Senate holds that they can place on folks. A majority of the board actually can be appointed by a recess appointment, and that actually can constitute a quorum. So the board can actually be appointed by recess appointment and meet and render their decisions without a lot of input from the United States Congress. That's one of the big dangers of setting up this board.
Well, Congressman, thanks so much for joining us today on the Washington Journal.
Glad to be here. Thank you, sir.
And that's